they can still avoid the situation that we are experiencing in some of the countries in Europe or Asia. The possibility is still there. Almost two groups of countries. We have countries that have more than 100 cases, and where situation is increasing is where our worry is, because very soon the system will be overwhelmed. You will not be able to investigate all the cases. Contact tracing capacity will be overwhelmed, and then you will be left with the option of only life-saving intervention. So for these countries, we are worrying, and they need to urgently scale up, increase the number of people involved in the response, involve more partners, and increase testing and treatment capacity. There is a group of countries for which we feel a bit disappointed that they cannot do more because it's countries that still have sporadic cases. And if you have only less than 20 cases, the ideal is to ensure that you have a comprehensive intervention, that you map or you list all the contacts. You can even afford to test many of these contacts and put in place a control measures. In many of the countries, you have already the confinements that make it easier to take this action. So for these countries, we are really appealing that they should scale up and make sure they can still avoid the situation that we are experiencing in some of the countries in Europe or Asia. And one of the critical points for Africa is what is maybe affecting the scale up is access to supply, to have a wider testing because the demand is higher. And without a solidarity mechanism, at least to ensure that we left on the market some quantity for African countries, it will be difficult. It's the same also for some equipment like ventilators. And as many airlines have grounded their aircraft, cargo capacity is also requested. So this solidarity mechanism is important for Africa to scale up, and we can still make a difference, stop earlier this outbreak if we can control it quickly in Africa.